Hello and welcome to this first in a series of presentations on somato-autonomic regulation of cardiovascular function. That somatic stimulation, that is to say stimulation of muscles, bones, joints and skin, can modulate cardiovascular function by way of the autonomic nervous system is an indisputable fact. It has been established in thousands of experiments in animals and in humans, and it's the basis for a number of well-established clinical syndromes such as paralytic ileus. What is less clear, but what we want to explore, is how somato-autonomic interactions can be exploited in the manual therapies to assist our patients. In this first presentation, we want to begin by talking about the innate rhythmicity of the heart before proceeding to discuss how autonomic input can modulate the behavior of the cardiovascular system. The job of the cardiovascular system is to circulate the blood throughout the body, delivering oxygen and nutrients, and removing the products of metabolism. The effectiveness of this circulatory function clearly depends upon the appropriate behaviors of both the heart and the blood vessels. Consequently, we have neural mechanisms to control both the rate of contraction of the heart and the amount of blood that it expels with each contraction. We also have neural mechanisms to control the patency of the blood vessels. This allows us to regulate the overall pressure within the system and to preferentially direct blood flow towards those tissues with the greatest immediate need. An interesting and important aspect of cardiovascular physiology is that so much complex and coordinated activity can in fact be conducted quite effectively in the absence of input from the nervous system. For example, the electrical conduction system of the heart can independently coordinate the behaviors of the four chambers of the heart to maximize cardiac efficiency. It is therefore all the more interesting to realize that layered on top of the intrinsic behavior of the electrical conduction system of the heart are controls mediated in the peripheral nervous system, in the spinal cord, and in the brain. In this presentation, we will examine intrinsic, peripheral, and central regulation of cardiovascular function. We will also see how neural input to the cardiovascular system can be monitored and even modified by somatic stimulation. Although there are hormonal mechanisms to regulate the behaviors of the heart and the blood vessels, in the short term, the cardiovascular system is most strongly influenced by the autonomic nervous system. In particular, vascular tone is regulated overwhelmingly by the sympathetic nervous system, with only occasional involvement of the parasympathetic nervous system. The behavior of the heart, on the other hand, is heavily influenced by both sympathetic and parasympathetic systems. The highest center within the brain for regulation of cardiovascular function is the hypothalamus, which is sometimes referred to as the head nucleus of the autonomic nervous system. The hypothalamus is shown here, just above the pituitary gland, in a sagittal section of the brain. The hypothalamus is represented here in a coronal view. Among the various nuclei of the hypothalamus, the parvocellular region of the paraventricular nucleus is especially involved in regulating output to the cardiovascular system. This output, in turn, is tailored according to emotional state, external stimuli, and stimuli arising from within the body, including from within the cardiovascular system itself. In this way, cardiovascular function is optimized to the whole symphony of needs presented continuously by the body. Thus, distinct but integrated mechanisms regulate blood pressure and heart rate. Quick quiz. Within the hypothalamus, cardiovascular function is especially controlled by which of the following? The contractile muscle cells of the myocardium are called cardiomyocytes. The cardiomyocytes, the individual muscle cells of the heart, are spontaneously active, and so, if cultured in the laboratory, will actually begin to contract rhythmically. However, For efficient pumping of the whole heart, the atria and ventricles must contract alternately, and the left and right sides of the heart have to coordinate their activity. Such fine balancing of contraction and relaxation requires a control system superimposed upon the spontaneous activity of the cardiomyocytes. That system is the electrical conduction system of the heart, and, as the name suggests, it conducts an electrical signal through the heart to coordinate the contractions of each region. The electrical conduction system of the heart consists of a sinoatrial node, the SA node, located close to the opening of the superior vena cava, and connected by internodal pathways to an atrioventricular node, the AV node, located at the base of the right atrium, behind the right atrioventricular valve. The atrioventricular node connects to an atrioventricular bundle, also called the bundle of His, which penetrates the fibrous skeleton of the heart to enter the interventricular septum. There, the atrioventricular bundle divides into left and right bundle branches, which run down the interventricular septum and then branch into many radiating fibers, the Purkinje fibers, which run throughout the myocardium of the ventricles. When the system is functioning properly, an action potential is generated in the sinoatrial node and spreads through the right and left atria, causing their contraction. The action potential is also conveyed through the internodal pathways to the atrioventricular node. There is a slight delay as the action potential is relayed through the atrioventricular node into the atrioventricular bundles and finally into the walls of the ventricles. That delay gives the atria a chance to finish their contraction before the ventricles begin to contract. If this system were not in place, the atria and ventricles might contract simultaneously, which of course would be quite useless. Now let's look at the anatomy and physiology of the system in a little more detail, beginning with the sinoatrial node. The sinoatrial node is a small band of specialized cardiac muscle cells which spontaneously generate an action potential at a fairly high frequency, about 75 times per minute. Sympathetic stimulation increases and parasympathetic stimulation decreases the rate. As this action potential spreads through the heart, it drives contraction, and so the sinoatrial node is also called the natural pacemaker of the heart. The reason that the sinoatrial node cells can generate action potential spontaneously is that their cell membrane is naturally leaky to the positive ion sodium. This is because the pacemaker cell membrane contains so-called funny channels, which allow sodium to enter the cell even when it is polarized. Quick quiz. The special channels which allow sodium to leak into the pacemaker cells of the sinoatrial node are consequently, the pacemaker membrane potential, the electrical charge on the inside of the membrane compared to the charge on the outside, never actually rests at a very negative level. It barely hovers below the threshold for depolarization, about -40 millivolts. And as positive charges leak into the cell, the membrane potential creeps above that threshold. For comparison, some neurons have a resting membrane potential as low as -90 millivolts. The sinoatrial cells seldom have a membrane potential below -60 millivolts, and so, as the membrane potential creeps above the threshold of about -40 millivolts, calcium channels open, allowing a flood of positive calcium ions to enter the cell, generating an action potential. As with other types of muscle, following the influx of positive ions into the cell, potassium channels open to allow potassium ions to escape, ending the action potential. Then the cycle repeats itself. Quick quiz. The ions which rapidly enter the pacemaker cells at membrane potentials of about -40 millivolts to cause depolarization are an important point here is that the rhythmic discharge of the pacemaker cells depends upon membrane channels which conduct sodium, calcium, and potassium. Interestingly, all of these channels are influenced by the neurotransmitters released by the autonomic nervous system. This is why the autonomic nervous system is able to regulate heart rate. Autonomic regulation of rhythmicity is something that we will look into in more depth in the second part of this presentation. Thank you.